opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of the Center for Mental Health Services, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. Today's session is brought to you by the Southeast Mental Health Technology Transfer Centers, or SEMHTTC for short, School Mental Health Initiative. We are located in Atlanta, Georgia at Emory University's Rollins School of Public Health. We are proud to serve 8 states and HHS Region 4 that you see pictured here. Our center includes faculty and staff with expertise in public health programs, finance, policy, and health systems, which provide us with a unique lens through which we can address mental health priorities in our region. The goal of our center is to accelerate the adoption of evidence-based mental health programs and practices by providing training and technical assistance to Region 4. And now I'm very happy to introduce our speaker today, Dr. Catherine Pickard. She received her doctorate in clinical psychology from Michigan State University and completed a 2-year postdoctoral fellowship at JFK Partners at the University of Colorado School of Medicine. Her primary research interest is in the translation of evidence-based treatments into community systems that are naturally positioned to serve autistic students and children with other developmental disabilities. Clinically, Dr. Pickard is a licensed psychologist and has a strong background in supporting autistic individuals across the lifespan. She holds expertise in parent-mediated intervention for young children, as well as cognitive behavioral therapy for autistic youth who have co-occurring anxiety. I'm now going to hand it over to Dr. Pickard.
Thanks so much, Sarah. It's wonderful to be here. And I really appreciate you all hopping on to spend your lunch hour with us for this learning session. Before we jump in and talk about the primary objectives for today and how the session will be structured, I wanted to provide a note on our identity first language use, both in the presentation today and in some of our materials. I just want to kind of read what is on this slide, which is that we do choose to use identity first language in our materials. We've made this decision in response to the neurodiversity movement, in response to the preference of many autistic adults, and in order to avoid the use of ableist language. We recognize, and as a clinician who's worked with autistic individuals and their families for the last 15 years, I recognize that this is not the preference of every individual, and that many people continue to use person first language. You may hear me at some point today use person first language, but within our materials and the products that we put out, we have made the decision to use autistic students, autistic youth, and autistic individuals for the reasons that are listed on this slide. The reference on this slide is to a fantastic article that talks through kind of decisions around language use, and I'm happy to answer more questions at the end of today during our Q&A. So let's dive into the session today. So for our learning session, I just want to make note that this is the first of a 2-part series. The session today is focused on identifying anxiety and other mental health challenges in autistic students. It is a follow-up to a webinar that was given on this topic last September. It was the first part in that September 2021 webinar series. I would highly recommend taking a look at that webinar if you haven't already. The content today is meant to build from that, so it will not be an in-depth didactic. Instead, the main objectives for today are to identify, for folks leaving this learning session, to be able to identify anxiety and signs of mental health challenges in autistic students, to describe risk factors for autistic students to develop anxiety and other mental health challenges, and to ultimately identify anxiety signs within one case example. So we'll be really diving into a case study and using some Jamboard actually to kind of generate discussion around the case study. Before we jump into some content, I wanted to launch a few polling questions just to get a sense of who is on this call and who's part of this learning session. I appreciate everyone dropping their name and where they are located in the chat box. That's helpful for us. But we do have a few polling questions. The first question that you'll see show up on your screen is, what is your professional role? Whoops, sorry about that. The second is, how much of your professional time do you spend working with autistic students? And the third is, how much of your professional time do you spend supporting the behavior and or mental health of autistic students? So if you could take a minute or so here to answer these polling questions, that would be wonderful, and I will share them back with everyone. Wonderful. I see those responses coming in. Great. Just take a few more seconds. All right. So I am going to just share back the poll just so you can get a sense of who else is on the call with us today. It looks like we have a good mix of people here. We have psychologists, social workers, counselors, and obviously behavior specialists, BCBAs. That makes a lot of sense. And a group of other. If you indicated other, if you wouldn't mind sharing kind of what you consider your role to be in the chat box. And then in terms of how much time you spend working with autistic students and supporting their mental health, majority of people are reporting that you spend half or kind of less of your time. And then same here. So this is helpful. And again, if you haven't already been in and watched the webinar that we did last year, would highly recommend that. All right, so moving right along. I want to spend the first 10 to 15 minutes of today giving you an overview of some of the content that was covered in that first webinar, just so that we're approaching our case study with the same kind of information in mind. And so this slide demonstrates the prevalence rate of mental health challenges in both autistic and non-autistic individuals. And so you'll see in this column right here, we have the mental health category, including ADHD, anxiety, depression, bipolar disorders, and schizophrenia. And what this shows is that by and large, autistic individuals are much more likely to experience mental health challenges than the general population. And so you'll see for anxiety, which is the focus of today, we know that about on average, 20% of autistic individuals report experiencing anxiety in comparison to about 7.3% of the general population. It's important to note that these statistics were taken before the COVID-19 pandemic. What we do know is that as we see across the board, mental health challenges in autistic youth and autistic adults have increased in response to the pandemic. And so I think that is important to know. There are a whole lot of reasons why autistic people are so vulnerable to experiencing mental health challenges. This slide lists a few of the most kind of prevalent kind of factors that we consider. The first being that autism may have a shared kind of biology with other psychiatric illnesses. Autistic youth and autistic adults are more likely to experience discrimination, victimization, segregation, bullying in schools, right? And those experiences certainly heighten their risk to experience mental health challenges. Some autistic individuals experience co-occurring medical conditions, things like seizures, that may make certain situations more anxiety provoking. And then we know that autistic individuals also are more likely to have executive functioning challenges and that may make certain tasks, again, harder for them. And then the last thing that I think is really important to note, and that we hear a lot when we talk to autistic students and adults, is that sensory differences make some situations very stressful, right? They make assembly stressful, the school cafeteria stressful. And so those things may contribute and make them more likely to experience anxiety. Before we talk about what anxiety, what kind of anxiety can look like in autistic students, I want to talk a little bit about what makes anxiety difficult sometimes to see in autistic students. And so the first thing that I think is really important to talk about is problem behavior. And so when we say problem behavior, what does that mean? Well, that means really specifically things like aggression, self-injury, and other difficult behaviors. Oftentimes, those behaviors are seen as naughty, right? A student being bad or being disrespectful, rather than mental health challenges. And that's not to say that all challenging behaviors like these things are anxiety, but when we see these things, it's our job to think about, well, why is that happening? And is that truly naughty behavior, or is something else going on? There's also a phenomenon called diagnostic overshadowing. And this is when symptoms of anxiety and other mental health challenges are seen as being part of autism. So for example, when a student is anxious and they're pacing, right? They're pacing. People might see the pacing and think, well, pacing is just kind of part of their autism symptoms, when in reality, it may also be a symptom of anxiety. Diagnostic overlap. So an example of this is when a student shuts down or is not talking to peers. So that social withdrawal or social challenge, right? That can be a sign of autism, right? And it's also potentially a sign of social anxiety. And so we know that like some of the symptoms, for example, of autism are also things, particularly when we think about social anxiety. Psychosocial masking, this has been a phenomenon that's been studied more over the last few years, and this is when students hide their anxiety or mental health challenges at school due to not wanting to appear different. And that certainly makes it hard to see. And then finally, in autistic youth, anxiety may also just look a little different, right? For some students, we see an increase in some of their special or kind of special interests or repetitive behaviors. And so, that increase in autism symptoms may be a symptom of anxiety that we don't necessarily see in our non-autistic youth. All right, so let's chat about common anxiety symptoms. Generally speaking, when we think about these symptoms, I typically break them into a few categories. And this is going to map on directly to our learning session next week when we talk about how to support anxiety. But the categories here are first physiological, right? So we experience physiological symptoms or symptoms within us, within our bodies, that signal anxiety. So things like rapid heart rate, shakiness, anxious facial expressions, maybe flat, kind of flat or nervous looking face, flushed face. Sometimes we cry when we're anxious, and we also experience things like sleep disturbances or eating disturbances. We either maybe overeat or undereat due to anxiety. There are cognitive symptoms of anxiety, right? These are things that we think, right? Cognitive distortions, right? So I'm going into giving a presentation, I'm thinking this is going to be the worst, I'm going to be laughed at. So really blowing things out of proportion. Negative self-talk, rumination, getting really stuck, not being able to stop thinking about something you're worried about, and really anticipating again that something negative is going to happen in a situation. And then behavioral, right? And this comes back to what we were talking about earlier. When we're anxious, there are all sorts of things we do, but one of the most common things we do is we avoid things that make us feel anxious. And so we see that both in the general population, we also see that with autistic youth. And we also see then reassurance seeking, right? And we all do this, right? When we're nervous, we're going to say things like, is it going to be okay? I think it's going to be hard, but you say, I think it's going to be hard because you're really looking for someone to say, no, it's going to be fine. You're going to do well. So this slide here depicts anxiety symptoms as described by both parents and by, you'll see on the next slide, school providers who work with autistic students. And this information was pulled from a research study that was specific to really asking, what does anxiety look like in your autistic students? How does it show up at school, right? Knowing that it may look a little different. And so this is what we heard our parents say. The first was refusing to do things, right? So that speaks to the withdrawal, not wanting to do things that are anxiety provoking, not wanting to go to school, being clingy, this is a direct quote from a parent, going nonverbal, so shutting down and not talking, flying under the radar. So this was a reference to sometimes when people are anxious, right? They do fly under the radar because they're quieter, right? They're not disrupting the class, and they go unnoticed because of that. Getting stuck in a loop, right? So again, that reference to that rumination, asking a lot of questions, seeking reassurance, getting stuck on things. And then one more reference to will get tough, direct quote, and say threatening things. So again, getting nervous and acting out. I actually want to go back to that. As part of the registration, there is the option to ask questions that you're hoping to get answered as part of this learning session. There were a fair number of questions around school hesitancy or school refusal, right? So what do you do when a child doesn't want to go to school because they're so anxious? And I want to acknowledge that those questions did come up. In our session next week, we will be talking about strategies to support anxiety, including strategies to support anxiety when it manifests as potentially school refusal or not wanting to do certain activities. And then just one more slide to demonstrate how providers described anxiety showing up in their autistic students. So again, reference to some attendance issues and tardies, so not showing up at school or being late, hiding under desks, leaving the classroom, perfectionism, so getting really kind of worried about making mistakes and upset when those mistakes do happen, disrupting class, sometimes instigating peer conflict, and just generally seeing a lack of confidence in students who are anxious. And again, these are descriptions specifically of autistic students experiencing anxiety. So with that in mind, again, if you're looking for more information on how to potentially identify anxiety in autistic students and are looking for a more in-depth dive into that, our first webinar from September 2021 provides more information on this. The learning session today is meant to be more applied. So taking those principles and applying them specifically to a case study. And so that is what we're going to transition to now. And so what we're going to be doing for this case study, I'll read the case study here in a second. We will read the case study and then we are going to transition into using Jamboard, which is a platform in which we can jointly brainstorm and answer kind of targeted questions together. And so I'm going to read the case study. After I read it, I'm going to share, I'm going to stop sharing my slides and share our Jamboard platform that we'll be using to kind of interactively discuss this case study. After the case study, we will come back for time for question and answer. But I'm going to go ahead and read the case study now, and then we will drop the link to the Jamboard in our chat box. And so please kind of be on the lookout for that. So this is a case study here. Darnell is in the 5th grade. He received a diagnosis of autism when he was 3 and received an IEP at that time, an individualized education plan at that time. His social skills have improved significantly. However, he's still qualified for an IEP under the identification of autism. He has one friend who shares his interests in cars and video games. Darnell participates in general education. He does well, but he does not like group work and is quick to correct others if they don't follow the rules of the project. Peers are starting to make fun of him and call him the rules police. When there is a group project, he now says he doesn't want to do it. He's now saying, I don't want to do it, or goes to the nurse with complaints of a stomach ache. This is happening every day. He has a huge problem at PE and recess. He has shared that he hates losing, not getting picked for a team, or having people watch him do a sport that he's not good at. He is protesting going to both activities and asked to go to the library instead to read about cars. His school team is wondering if anxiety is at play and if treatment is needed. And so I'm going to leave this up for just a little bit longer in case there are things that you want to kind of pull from the case study. And while I have it pulled up, Sarah, if you wouldn't mind dropping the link to the Jamboard in the chat box, you should be able to click this link and it will take you to our Jamboard where we have some targeted questions about this case study to facilitate discussion. All right, I'm going to share that Jamboard. So bear with me while I pull it up. All right. So here it is. And so what you're able to do on the Jamboard, we have a series of questions here. You are able to, on the far left side of the Jamboard, there is a menu of options that's listed vertically. The fourth option is a sticky note that if you click, you're able to add responses to. And we have some targeted questions that are designed for this case study specifically. Let us know if you have difficulty opening this up. The first question is, what specific behaviors make you think that this student may be experiencing anxiety? And I love seeing that some sticky notes are already coming in. All right, so I'm gonna start to group these. I see avoiding activities that he isn't good at, rigidity to adherence and rules, stomach aches, isolating in the library. I'm gonna group these two things together, right? Wanting to kind of avoid or be away, stomach aches, right here. Rigidity, right? Adherence to rules. It sounds like that is something that he's really getting stuck on. And it sounds like is really kind of getting in the way of peer interactions and that he's potentially being bullied because of it. What else do you notice, or are there other things that you want to make sure that we add to this? I'm going to add one. I'm going to add just negative, kind of I'm just going to add kind of protesting and potentially negative self-esteem. Not wanting to do group work. Yes, social anxiety. I appreciate that. All right. So I'm going to group this with our kind of wanting to avoid tasks. For those of you who have responded, right, we have our, our avoidance group of stickies over here. We have our physical symptoms that we're seeing. We have our rigidity group here, and also potentially some of that negative self-esteem, negative self-talk that's coming up. For those of you who have written stickies, I see some in the chat box as well. Oh, could you put the scenario in the chat as well? Absolutely. Sarah, would you be able to do that? Awesome. For those of you who did add stickies to the Jamboard, what I would love to hear, I guess, is any rationale that you have, right? So, and you're welcome to unmute yourself at this point and talk through why it is that you put stomach ache, why it is that you put rigidity to adherence to rules. What makes you think that those things are anxiety? Another question, I guess, that in addition to kind of your rationale for putting these stickies down is, are these anxiety symptoms that you typically see in your school setting? So things like stomach aches, isolating, withdrawing, being more rigid. Are these specific behaviors that you notice within your schools? You're welcome to use the chat box or unmute yourself to talk through kind of your rationale and what you see in your practice setting. Uh-oh. There you go. Danielle, would you mind sharing what you wrote? Oh, sorry, I saw you unmute yourself. I wasn't sure if you're about to share your response. All right, Allie, thank you so much. Yes, I definitely see these behaviors in my schools. Fear of being judged by others, absolutely. All right, I'm gonna put that over here. Stomach aches can be a symptom of anxiety. Absolutely. We see this as one of the more common forms of anxiety, especially in our autistic youth, right? So we see trips to the nurse's office for stomach aches, headaches, other kind of bodily ailments, right? And in part because, right, when we are anxious, sometimes we do experience those bodily sensations, right? But, we may not know, especially our autistic students may not know, right, that those symptoms are anxiety and not necessarily a physical ailment. No worries, Danielle. Let's move on to the next question, which is, what makes you think, and I think this is a really important question, and I would love to hear your responses to it. What makes you think that this student may be experiencing anxiety and not just demonstrating challenging behavior, right? We talked about one of the biggest kind of challenges in identifying anxiety is sometimes attributing, or thinking kind of behavior is just behavior, right? Behavior is being naughty, or behavior is avoiding, behavior is trying to get out of things. If you were working with this student, what do you think, right? What makes you think that it may not just be behavior? I appreciate that. I am actually going to take, Donna, your response and put it into a sticky. So, whoops. They are taking steps to avoid the activities. All right. What else? That avoidance piece is, I think, a really important indicator or a really important flag. Laura, she's saying worries about others' reactions being picked on. I am going to also put that in a sticky. So worries about others' reactions. And the physical symptoms becoming very real for these students. Absolutely. I'm just going to make reference here to the physical symptoms. All right. Okay. And they are a good student when working alone. Right, right. So this is very, context dependent, right? This is an avoidance of every situation. It feels like there's something about these specific instances with other students or instances in which the activity is hard that are particularly challenging for the student. So I appreciate these comments. So again, we have worries about reactions, right? So a direct reference to worry, a direct reference, I think, to avoidance, the physical symptoms piece. So complaining about the stomach ache, which is a common symptom of anxiety, and the fact that this is, again, very situational. It seems to be that there are certain things about this setting that make it particularly potentially anxiety provoking for this student. The need for rules to be followed. Yes, I'm monitoring the chat box while also having Jamboard pulled up. Absolutely, trying to apply kind of structure and control to a situation to make it feel more manageable or feel more, more tolerable. I asked this question again, just to remind, and I think everyone here is here to learn about mental health, but to remind us that when we see behavior to really think about whether it may reflect other mental health challenges. This is an important question, right? This is a brief case study. If this were your student, what other information would you want or need about this student to feel confident that they are experiencing anxiety? What are things that you would want to know that you don't know, that would signal to you that it is definitely anxiety and maybe not other things going on? Parent input. Okay, I'm going to write that because that is extremely important. Thank you so much, Beth. Yes. Parent input. Yeah. We might want to ask, what's going on at home? Are these things that parents are also seeing? And what do they think about them? What else would you want to know? Allie says, I'd be interested in learning how they behave in the classroom and at home, and if I'm able to observe them in their friendships. Yes. So again, I'm same reference, interest in learning how they are at home and observe friendships. Yeah. It would be nice to see if in more comfortable social situations, right, with friends, if some of these things come up. I appreciate, again, the reference to seeing things at home. What else might cue you into anxiety? Or what might, maybe not cue you, but what else might you want to know that would cue you to it being anxiety or not anxiety? Yes, thank you so much. I'm not sure who this unicorn is, but this is exactly what I would want to know, which is we want to have a conversation with the student, right? It sounds like this student is using spoken communication, and I would totally want to get their thoughts on what's going on and how they're feeling. Now, to your point, right, some students do have challenges really identifying those emotional experiences. And so the extent to which they're able to do that, you know, we don't know, but I think it would be really important to be able to do that. Over here, I want to know if Darnell thinks these symptoms are holding him back from doing what he wants to do and reach his goals, feeling happy and safe in school. Definitely, I'm grouping these over here as kind of, we've got kind of overlapping kind of home parent input. And then we also have input from Darnell. Yeah, and one of the ways I think, you know, and again, we'll be talking more about this next week when we talk about how do we support these anxiety symptoms. But one of the ways that we understand the severity or kind of extent of anxiety is understanding that exact question, which is how much is this getting in the way? This is also how we get buy-in or motivation from our students. Right. So, you know, it's not always fun to get extra support for mental health. But one of the things that we try and help students see is that anxiety, when it is present, right, really does get in the way, right? It makes it harder to have fun. It takes up time that could be spent doing other things like special interests. Donna, I see your comment. And so we do want to know, you know, how much is this really kind of interfering with or getting in the way? Yes, and Donna, I see your comment about, does it happen when kind of special events come up? Wonderful. Well, you know, when I wrote this question, you know, what I was really thinking about was, again, how do we just get more information, get parent input, and really kind of get good input from this student, you know, if they are able to provide that, you know, the able to kind of have insight into their emotional experience. Which is related to this fourth question, which I think is a really important one. Someone already alluded to it. The student does use spoken communication, which may make it easier to identify anxiety. right? So what behaviors might you pay attention to for students who do not use spoken communication, right? Who are not saying, I don't want to, or verbally protesting. So what behavior would you pay attention to for students who do not use spoken communication or who also have an intellectual disability? Stimming, I appreciate this. Any new behaviors? Yes. What else? Tantrums. I was going to add, behavioral indicators of protest, self-injury. I'm going to add that. Someone put that in the chat. Elopement. Thank you. I'm glad I am not responding. These are exactly things that I was thinking about. Elopement, self-injury. Yeah, and when I just want to give some clarity, when I think STEM, I absolutely think about stimming not for a long time, but for a number of years when I was in Colorado, I was running anxiety groups based in CBT for autistic youth who also had an intellectual disability. And one of the things that we saw a lot in those groups was the presence of more kind of stimming when anxious. So that could mean rocking, right? Flapping, making noises. And we really did see those things, crying. And again, withdrawal. So I'm going to try and organize these a little bit to the best that I can. Any new behaviors? We're going to put some of our more challenging tantrum, self-injury, more challenging behaviors in this group here. We also have this kind of elopement, withdrawal, avoidance group over here. And then this stimming point, again, really kind of highlighting that for our autistic youth, we do sometimes see an increase in our kind of symptoms of autism as a result of being anxious. And screaming, crying, isolation. So those screaming and crying would kind of fit over in this group. We also have isolation, which would be, again, trying to kind of remove yourself from the situation and avoid the situation, right? And this is a great, this is a good example, again, of the fact that, when we see these behaviors, right, it is our job to understand, why is the behavior occurring? Is it, avoidance? Great, but why is the avoidance happening, right? What is kind of causing this to be a challenging situation for the student? All right, I see isolation again. Yes, a lot of kind of pulling away. And then our last question before we're going to transition from the Jamboard back to open discussion and Q&A. Our last question is, if you suspect this student does have anxiety, which it sounds like some of us here are thinking that might be the case, what are your next steps? And some of this we've already talked about. What are your next steps to confirm the anxiety? And more importantly, what are your next steps to support this student in school? What would that look like in your school setting? I would love to hear what you say. I think this will both be helpful to kind of see how people respond to anxiety in these situations, and also will be important information moving into our second learning session to see kind of how anxiety is naturally supported. So what do you do? This is your student. What's your next step? Yeah. Consider using an anxiety screening tool. Absolutely. And for the person who just dropped that sticky note, would you be able to add to it the screening tools that you use in your school?
It was me. This is Emily Curtin.
Hey.
I absolutely would, but actually I only work with autistic students, and the tools I use in my district are pretty narrow. So it would actually be the building psych that would be doing that for me. And I'm going to be honest, I don't know what they use here. But I know it's something that is done.
Yeah. And I know that there's a lot of variability across schools. Some people use broad mental health screeners that cover a lot of different domains. Some use anxiety specific screeners. What else would people do? I see Danielle ask a scaling question to confirm level. Yeah. So maybe you don't have an anxiety screener available to you, but you're gonna probe more with the student to understand how much it is getting in the way. What else would you do? So you would screen, right? We would do our best to kind of figure out the extent of this. Develop a multidisciplinary team. I'm going to put this, develop a multidisciplinary team. Not spelled correctly, but we'll go with it. Yeah, totally. And who's on that team, Donna? I'd ask teachers if they would allow them to have a fidget toy in class to help. All right, I'm going to add that here. And fidget toy. And Allie and Donna, would you be able to kind of expand on who's on the multidisciplinary team and why the fidget toy? Like, what might it do, right? I think you're getting at something really important. Yeah, exactly. Okay, so Donna in the chat box is saying that on that team, it might be the parent, right? The guidance counselor, a teacher, a nurse, the gym teacher, whoever might be able to support the anxiety, or at least kind of be able to weigh in about it. Yeah, and I had asked Allie specifically about the fidget toy. If they're able to have a fidget toy, right? We're talking about what are things that help people to feel calm, right? And we're going to talk about this next week, but there are strategies that we all use when we're anxious to help regulate our internal state. And so a fidget toy, right, may be just one example of a strategy that may help a student regulate their emotional state. So I appreciate that. If the student sees any outside mental health providers, speak to them about your concerns and see if they have similar concerns. Absolutely. So understand, right? Does this person already get support for this? And understand what resources might already be available and how the student is being supported. All right, so I have screening. Let's see if I can, I like this because these fall into different groups here. Develop a multidisciplinary team, and putting these two together because they involve kind of the use of providers. We have our screening domain here and I would consider this an emotion regulation strategy, right? So an actual strategy that you might use to help the student. Danielle, I'm just going to read your comment in the chat box. You're saying validate the client's feelings of anxiety, have the school counselor potentially reach out to the guardian to connect to resources or a therapist to help process thoughts and feelings related to anxiety to increase the ability to cope and challenge thoughts. I love that. I'm going to put a brief little sticky note here. I'm going to say connect to resources. Put that. And then I'm also going to add your other one, which is use of strategies to cope. All right, I'm gonna put that here. And again, kind of our connection to outside resources. Yes, and your reference to strategies, again, are important ones. They're ones that are directly related to anxiety symptoms and what we'll dive into in our next learning session, which is we need strategies to calm our body, and we need strategies to regulate and manage our anxiety thoughts. And so I appreciate reference to both of those things. Wonderful. Well, we are going to transition back to Zoom, regular Zoom in the slides here in a second. I really appreciate you posting sticky notes and sharing your responses to these questions in the chat box. This is meant to be a discussion around how we see anxiety and manage it. And we're going to transition to Q&A here in a second. 504 plan, yeah. So, and no worries about the delay. Yes, if this student, to someone's point, if this student is not getting support at school and the symptoms you feel are right starting to get in the way, it may be very well worth exploring whether a 504 plan or formalized mental health services makes sense at school. All right, I'm going to stop sharing my screen and transition back to the slides. I just want to give a quick note that at the end of this is our first time doing a learning session, if you will, that is brief and geared towards case study discussion versus just kind of didactic per se. We are going to be dropping a link to an evaluation survey in the chat box that is going to be a great way to give feedback around the structure of this presentation and its relevance to you. So please, when you see that come through at some point, complete it before you hop off today. All right, we moved through these questions. All right, so we have about 10 minutes that are left for question and answer. And so I just wanted to open up the open up discussion around anxiety. This could be comments or questions about the content today. You're welcome to drop them in the chat box or unmute yourself. What questions do you have related to identifying anxiety or comments that you want folks to be aware about? No questions. What, I guess, and again, thank you, Donna, for posting a comment here. The severity of the disorder is important to identify when working with anxiety. Absolutely. Being able to understand the extent to which anxiety gets in the way is important. And I think, my experience has been when working with students who are anxious and working with autistic youth, once we start working on anxiety and start identifying it, right, it becomes much easier to see how it kind of expands and is relevant to other areas of the student's life. So even though we might see it in the classroom, when we start paying attention to it, we also see it show up in friendships. We see it show up in extracurricular activities. We see it show up at home. So it's really important.
I thought maybe I could say it instead of type it.
Yeah.
But something you said at the beginning, I think we hear, well, not some of us hear autism and we just think, okay, yeah, anxiety. And we just like leave it there. We do some interventions, but we don't focus on it, separately or differently like we do with kids that are like affected by trauma.
Yeah.
So that it's like, I know that, but you saying it made me think, oh yeah, I really have to try to help teachers approach it separately. It's not just a part of autism.
Yeah.
I appreciated that.
Yeah, I agree. I think it's, and I with the sentiment as well, which is that, in working with autistic students, we often are focused on autism, right? And focused on supporting autism. And I think it is an important shift to say, mental health, to Donna's point and many other people's point on this call, can really get in the way. It can really make things hard for students, and not only that, make it less fun just to be, and so we're really trying to, I see some questions in the chat box that I'll kind of transition to in a second, but I think you're right, like we do want to really pay attention to how mental health gets in the way, because it is something that, and we'll talk about this next week, it is something that anxiety is treatable, right? It is something that we have a we have a good sense of what is evidence-based and what can support these students. And it can make a big difference in their quality of life. Just want to make sure I'm seeing some of the questions here. Donna says, how do you recommend helping the student to gain insight into the symptoms? That is such a good question. We will keep referencing our session next week in part because we're going to be diving into actually what does it look like to support these students, but helping them to gain insight, helping them to understand that, man, when I have a stomach ache, when I avoid that situation, when I start crying and shaking, like that is anxiety, right? Helping them understand that and name it is really powerful, right? Because when we name it, it becomes something that's easier to support than just saying, oh, well, you know, that's just naughty behavior, or oh, that's just part of who you are, you know. So we'll talk next week a little bit about some of what those strategies are, but it is a first step, right? It's that foundation in supporting anxiety is identification. Laura says, I think it's important to educate families and other professionals that anxiety is very common in autism, but that it is treatable. Yes, 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 I completely agree. And again, it's so important, and we see big shifts in quality of life when it is supported. I'd love some more ideas for helping autistic students become aware of their physical symptoms of anxiety when they have difficulty interpreting feelings in their body, which is what we were just chatting about. We will absolutely talk about that next week. There are some, and we'll talk about specific programs that were designed to support anxiety in autistic students, because we know that that identification piece is so important. And working with adults with mental health and autism is challenging. It is. It is. I've spent a number of years working predominantly with teens and adults, and mental health can be very challenging, especially when there is rigidity around some of the negative kind of thoughts, and it can be hard to break some of that rigidity. And Danielle, thank you here. Remember that anxiety can look different in each person and child, and teaching cycle of anxiety and knowing how to interpret those cycles and cope. Always acknowledging any progress, small or big. Progress is not progress, not perfection. Yes. And so really, you know, again, I think this reference to the fact that we can support the mental health of our autistic students, or students who have other neurodevelopmental differences, and that oftentimes this support makes a big difference. And so in our second learning session, we'll be jumping into specific strategies. Please feel free, you know, to, if there are other questions or comments that you have, to unmute yourself. I see that Sarah dropped the link to our survey in the chat box. If you are able to fill this out and give us feedback, that would be really wonderful. And again, we're thinking about how best to structure these learning sessions. We want to facilitate conversation. And next week we'll be having a similar session, but focused on treating or supporting anxiety. So again, this is the learning session 2, and the objectives for it. This learning session will be directly tied to the second part of a webinar that was provided in September 2021 that was on evidence-based approaches to supporting autistic students in school, and it included a description of specific strategies that we use to support these students. The next learning session will provide a brief snapshot of what was covered in that webinar, but I highly encourage you, you know, if this is a topic that is of interest, to take a look at that webinar and some of the other products that we have available related to this. The specific objectives for next week are to describe evidence-based approaches to support anxiety in autistic students. A lot of you on this call have already started to describe strategies that are, you know, that sound familiar, right? And sound evidence-based. The second objective will be to understand different ways that mental health programming can be delivered to autistic students in schools. So it's one thing to know the strategies, but how the heck, you know, do we do that in school, right? And what does that look like? And then finally, to identify strategies that can support an autistic student with the anxiety in a case example. So we'll really dive into a case example and talk through, okay, how are we going to support this student in understanding what their anxiety symptoms are? What does that look like? How are we going to support their emotion regulation? How are we going to support them in using and kind of challenging some of the thoughts they have? And then how are we going to help them be brave, right? And experience kind of the positive outcomes as an association of being brave. And then finally, just to wrap up again, you'll see that survey and the link to our products in the chat box. If you wouldn't mind, as we are really trying to be more intentional about kind of the mental health of our autistic students, what are in the chat box? Could you just let us know what are mental health topics that you would like more information on? And specifically for those topics, how would you want that information presented? Is it a didactic? Is it a learning session? Is it a Q&A? Give us a little bit of information on what would be most useful to you. And thank you so much. If you have, you'll see my contact information on the slide here, and I'll also drop my email into the chat box now. If you have specific questions about anxiety or mental health in your autistic students, you're welcome to email me or ask for additional resources. I'm happy to share materials over email if there are specific questions that you have. And I will drop that email here. And then there's some information. We encourage you to keep in touch with us both on our website. You can sign up for our listserv if you haven't already, and are able to follow us on Facebook and Twitter. Here is that link to the evaluation, and it's also in the chat box.
Yeah, as Dr. Pickard mentioned, we do have an evaluation that we would greatly appreciate if you could complete. As part of receiving SAMHSA funding, we are required to submit data related to the quality of this event. We ask that you please take a moment to complete a brief survey about today's session. After you complete this survey, you'll be redirected to a second survey that includes additional information our center likes to collect to continue to improve the quality of our trainings and make sure we are addressing the needs of stakeholders in Region 4 through our programming. We would greatly appreciate it if you could take an opportunity to complete the second survey as well. And thank you all for attending our session today.
Yeah, and thank you for dropping information into the chat box around topics that are of priority to you.